morning, we are talking women's heart health. And right now, our Courtney is getting a health screening from OSU Chief Wellness Officer, Dr. Bernadette Melnick. And did you know that heart disease is increasing the fastest among young college-age women now? It's the #1 killer of women, more than all cancers combined. Even more shocking, one woman nearly every 8 seconds is diagnosed with heart disease. The Ohio State University and the Women's Heart Alliance are partnering together to help raise awareness and to reduce the rate of heart disease. So here to tell us more about the new initiative is Congresswoman Joyce Beatty. So glad to have you with us.
I am so excited to be here. Thank you.
Oh, of course. And you know, in your role as a public servant,
Yes.
there are so many causes you could be behind. So why are you behind this initiative?
Well, number one, I'm a stroke survivor. And also, it's the #1 killer. When you think of cardiovascular disease and stroke, #1 killer for women. And so I figure as someone who, the public figure, it's important for us to tell our stories and to be able to help other young women. And as you mentioned earlier, so many young women, college-age women, are suffering from this disease. So I have a great story to tell, and I like talking about it.
Well, can you share your story?
Well, it wasn't that long ago, it seems, but yet it was in 2000. And I was a typical person, busy schedule, thought I was of perfect health and fitness, but the #1 thing I want people to remember is I was not listening to my body.
What was happening at that time?
I was tired, and you know how you push the envelope, so you say, I'll just go 4 more hours instead of listening to your body and doing something about it, following the instructions. You know, I'd have a headache, and I'd say, oh, I'm tired.
Yeah.
So I didn't even drink coffee, but I'd have another cup of coffee, forcing myself to go on.
Wow.
And then one afternoon, came into the office, and something felt funny. I was actually taking a phone call and wasn't able to articulate my words.
Wow.
And then it was something that just riddled right down my body.
Is that painful?
I don't remember it being painful as much as scary that something was wrong. I was trying to talk, I was trying to use my hand, and it went limp, and then I just collapsed in the hallway.
Oh my goodness.
And then I was, as everyone else tells me the rest of the story, I was downtown, so that was good. Downtown local hospital. I got there relatively fast, had great doctors and great nurses, but yet my cerebral brainstem stroke, it was months before I was able to leave the hospital and then go to a rehab center. So I was very fortunate that I went to a stroke rehab inpatient center where I got the best treatment. And even with that, they said I'd never walk again and my speech would be different. So I wear 3-inch heels to prove a point.
There's no problem here.
There is hope as long as you listen to your body and you do all the preventive things that are out there. You too can be a survivor.
What did they determine was the problem for you?
Well, for me, it was a series of things. I was predisposed, hereditary. My grandmother died of cardiovascular disease, had a stroke, but I attributed that to, she was old. That couldn't happen to me.
Yeah.
She was in her 80s. I was just turning 50. I had high blood pressure, which I knew about. Probably not always taking my medicine like I do now. And then they found out that my cholesterol was off the chart.
Was it
was
really?
so high.
Oh my goodness.
So regular checkups, asking the right questions. And the thing I want people to know, you can't be a little anything. So if someone says, your high blood pressure is a little high, your cholesterol is a little bad, then you should stop and say, what do I need to do? Most people just say, okay, I'll wait until it gets real bad.
Right.
And I was one of those individuals.
Now, what is the importance now that we get this message out to younger girls in particular? I'm amazed that we have to focus on younger women.
Well, it's so important because young women are so active today, and they're doing so many things. But medicine is a lot better than it was 15, 20 years ago. There are so many great things you should do. But I think the #1 thing I want to tell them, get a physical. Right. When you're young, you don't think about going to the doctor until you're sick. Know what your status is. Know your body conditions. Know what high blood pressure and low blood pressure means. Know about your good and your bad cholesterol. But most importantly, listen to your body, do something about it, and then follow up.
And you've got to get their attention, though, because young women think they are Teflon.
Oh, my God, young women, and a little more seasoned women, we think we're Teflon.
I know.
And so I'm saying to all the young women out there, be a role model. You know, be out there so you can tell your story, that you caught it early or that you're a survivor. And I think it helps other young women. So I'm going to tag this. When we talk about Women's Heart Month, it's women helping women. It's a heart movement.
That's right, absolutely. I'm so happy you are healthy.
Thank you.
So good to have you here. And as we were saying, you know, this initiative is ongoing, so let's make sure we get the message out. Thank you, Congresswoman.
Thank you.